Madam Chair, and thank you very much to our witnesses today for helping bring some significant insight. You've helped us understand more and more the disparate, desperate challenges faced by Black, racialized, and marginalized disabled people, women. You've helped us to, this particular committee, to focus on the need for disaggregated data, something that frankly does not exist. It's not available, and it wasn't considered in the development of this benefit. And there are no mechanisms to collect or capture this data right now. We've heard in our past from past witnesses about modeling being used as a tool to project numbers, to estimate, and to help us understand the impact of absolute numbers and of intersectionality on the poverty of disabled peoples. Do you have any thoughts on this? How would we capture this data, and what is the role of this data going to be in administering this benefit and in over time tracking the impact of the benefit?
Ms. Anderson or Ms. Brayton, who would like to start this question?
And certainly.
So in terms of data, I feel like sometimes there's data there, but just not publicly available. Collectively, yes. You know, those should be considered, like analyzed to make sure that you're capturing in the bill, right, that anything that's mentioned there, it's inclusive and it will actually have an impact on the most marginalized. You know, after the bill, you definitely have to evaluate if it's, you know, reaching folks that are most marginalized. You know, it suggested maybe doing something community-based, again, led by Black and disabled folks or organizations. Collecting that data, perhaps about folks who are accessing the bill, and again, it's not to surveil. I know a lot of times when you think about data, it's to surveil. Yeah. It's really to be purposeful, and again, it's to evaluate. You know, you said this is supposed to reduce poverty. Is it actually reducing poverty? And also, like, who is it impacting? Who is accessing this bill? You know, I can look at perhaps the disability tax credit. You know, if you looked at maybe if there's disaggregated data for the disability tax credit, you know, can you see like who is accessing it, who are overrepresented in accessing it, who are left out? And then you start asking questions. Then, you know, if Black folks with disabilities are not accessing the tax credit, then why? You know, what is there barriers that we can address? So that's the purpose of like collecting that disaggregated data to make sure that folks are actually, you know, folks who are at the margins are accessing and benefiting as well.
Thank you, and thanks for the question, because we bring it up all the time, complain about it all the time, and at the same time I agree with Janelle around the surveilling and the risks that people feel in terms of self-identification, and even some of the reasons Bernard talked about in terms of why folks won't, right? And so I think if you are going to collect the data, it has to have the purpose of serving the people you're interested in finding out about. And I wouldn't say that I could come up with a really sharp answer for you today, Senator Moody, in terms of what we should do or how. I think what you're bringing up is extremely important, and I think thinking through, as Janelle has said, the mechanisms by which we use some kind of a model for ensuring that the most marginalized are getting at this, but that probably, again, includes what we've both been harping on a lot, right, which is you have to build the capacity of the organizations who need to connect with that community and build trust. Peer support is such a fundamental gap for our communities. In terms of the work Dawn is doing right now around gender-based violence is completely focused on peer support because, as you all know, we're the only ones who show up here. Why? Because there are no other women-led women with disabilities organizations. So, you know, there's a lot of work to do, but it does start with some of this data and how we use it. Thank you.